you're more than just a physician in many ways who just deals in physical hands and bodies. As a doctor, you're also involved in the psychology of
Yes.
the patients. You have to be. So it's taken him some time to recover physically. How have you seen his mental recovery and his attitude over the months?
I think has been very good. You know, I think when someone comes in, they're concerned, is my hand going to work? It's my livelihood. So definitely, they're very depressed. And I think one of the important things that what I try to do, especially to get the patient to, when you have a sense of control or the knowledge of what happens, that obviously or make you feel part of the team, that sense of control makes the patient feel better. It takes a lot of that anxiety and depression, especially when you don't know where you're going. That generates a lot of anxiety and depression. But when you know where you're going, we give him a trajectory, and I make him feel part of the team, and I'm telling him, this is what we're going to do. This is possibly what's going to happen. If this X, Y, or Z things happen, we will, we will do this or that procedure. So I try to empower the patient so that he has knowledge, and that definitely helps him a lot. So I think, obviously, as we're working with the physical therapy, obviously his ego and everything has obviously all improved, because now he knows I can do it. I'm getting there little by little, and I tell him it's going to be a one-day process. We'll take it day by day.
But was that the most important thing, though, when you have to get into his head a little bit and you have to tell him, you will get better, you will play again, you will be able to do this? That's what it still sounds to me like the psychology is more important than anything.
You got to have a lot of psychology in it, because if those patients, it doesn't matter really what I do in the patient. I'm 50% of it. He has to participate in his physical and occupational therapy. And in a patient that's beat up, if mentally they're not moving with their therapy, they don't collaborate, it's not going to move. It's going to be painful. It's going to hurt. There's days where they're not going to feel well. There's days where it's going to be complications. There's potential for even surgical complications. He has to deal with new scars that he didn't have even as we generate those donor sites. So it is going to be tough. So you have to work with the psychiatry. But I really, at the end of the day, I don't want to sell them a false idea. I'm giving realistic expectations. But if they feel that they're part of control and in the decisions of what's going to happen with them, they feel empowered, and then they feel much better.